this may come across as a surprise, but if you are a human and you have a nose, you should be able to breathe easily through both nostrils. You also should be able to go through a day with no pain in your cheeks or in your forehead or headaches. You shouldn't have a running nose. Allergies shouldn't really be impacting your life that bad. And sometimes that is a surprise to people. And that's why we're speaking with our guest today, Dr. Daniel Leeman. Dr. Leeman, thank you so much for joining us.
Zed, my pleasure. Thank you so much for inviting me to come and talk to your folks and come and educate them on some of the common things that we see. It's truly my pleasure today to be on with you. Thank you so much again.
Excellent. So let's make sure that if someone's watching this, that it is really for them. What are the most common frustrations you hear from patients that you treat?
So many patients come in, they complain of basically stuffy nose, nasal congestion, postnasal drip, runny nose, discomfort in their head, headaches, sinus pressure, can't sleep, just are miserable. And basically they're living day to day, their day-to-day existence is basically taking over-the-counter things just to make it through the day, because they don't realize that, hey, there is a better quality of life, a better chance of improving if they just kind of do an investigation with my practice. We can help eliminate nearly all of those complaints that I see. And the proof really is in the pudding, because I have tons of testimonials on my website of how they were before we saw them in the practice, got them treated, and on the backside, what an improvement in their quality of life and how life-changing it is for them now. The feedback I get is, I'm disappointed I waited so long to come make an appointment with you. I should have done this years ago. This is life-changing.
That's great. And I think what's interesting is, you really nailed it on the head with they're going through life, and there are people out there that think that they're just supposed to live that way. And it may also look like maybe you go to an urgent care center every couple of months. And what we want the audience to know is that's not true. And do you ever hear about that, where someone's maybe been going to urgent care for a while?
Yeah. I mean, I hear this day in and day out in my clinic. We will see patients who come in, they go to the urgent care every couple of months, get their routine Z-Pak prescription, take it, they feel better. They're still using their over-the-counter medications. Their kind of quality of life is improved somewhat after the Z-Pak. And then within a few months, they're back in the same cycle. It's like rinse, wash, and repeat. They're doing it over and over. But what we're looking at is figuring out, well, what is the root cause? Why does this continue to perpetuate and happen? And what can we do from the tools that I employ to prevent this from happening and break that cycle? And not only that, there's tons of patients who realize that they just didn't know that, hey, you should be able to breathe from both sides of your nose. And they don't even realize that, the nose is such an important component of normal respiratory function, normal sleep. You have to have a clear nasal passage to get the required rest, to kind of reboot your body, get that, kind of improve your quality of life. If you're not sleeping well, your quality of life's not going to be good. So it always amazes me. And the patients that it's like the smile on their faces, when we, actually remove their splints the first post-op visit, and they're like, oh my goodness, I never breathe like this. Well, this is the way, your nose is intended to work. We're just putting things in alignment, getting them opened up and getting them so where they're working to help you and not be a hindrance to you.
It makes a lot of sense. And what's also, I think, important for people to understand is the tools that you have available to treat all the things that we've talked about. Let's say someone 25 years ago was going through this. It was a lot different process. You could still fix these problems, but it wasn't as minimally invasive as it is today. So sometimes
so
people are a little bit
this
scared.
Sort of was one of the things, like early in my training. Now I've been in the Austin community for going on 22 years. So I've been out this a long time, and certainly there has been changes on how we address and treat things with the newer technology that is less invasive. So if we kind of roll back to kind of when I was doing what we call residency, where I'm kind of actually have my medical degree, but I'm doing more advanced training in ear, nose, and throat, we were doing a lots of sinus surgery, but it was really sinus surgery that was really deconstruction and really just opening up things wide. And lo and behold, through, patient testimonials and, walking them through that healing journey after that surgery, we discovered, well, there may be a better way, a better mousetrap out there where we can achieve the same outcome, basically open things up, but do it in a more targeted fashion. So now I have tools and techniques that we use. They're deployed right here in the office. You don't have to go to the hospital. It's done right here in the safety of the office, where we can achieve, I feel, better results for the patient in the fact that we're doing targeted therapy. And essentially what we're doing, it's sort of, I think most people are familiar with the concept of angioplasty. I like to call it sinuplasty, or basically a balloon that we use to open up these narrow or totally obstructed sinus passageways in a minimally invasive technique that achieves just life-altering, life-changing results for the patient going through it in terms of the quicker recovery time. And then sort of, I will kind of give you a little vignette of a story I had on a patient who, this is probably 12 years ago, and she had presented with a lot of unilateral facial pain and pressure. And basically I ended up taking her to the operating room, doing that kind of older school technique, which, we commonly refer to kind of as a roto-rooter. We're kind of just going in there and just really removing everything, stripping everything out there. And there's honestly, there's some collateral damage in that process and sort of a longer recovery process. And then at that same time, we were starting to get into this little bit more non-invasive, minimally invasive technique. And about, oh my goodness, like within probably that year where she had that one surgery, she started to get it on the opposite side. And so she was perfect. And I said, well, look, we did this procedure on your other side, but I now have this tool that I think would be very effective to you and not have the longer recovery time. And we went ahead and did this balloon procedure on her. And oh my goodness, she was like, this is unbelievable. I feel great. And her recovery time was like 2 days versus 2 weeks. So you're taking something that was a 2-week sort of healing journey and knocking it down to 2 days. And, she couldn't just thank me enough, and just like, was a raving fan for us, because, she's sort of the, the person who's kind of experienced both ends of the spectrum.
Right.
So now, the majority of what we do is that balloon sinuplasty technique, which really has been life-changing for many, many of my patients.
That's great. I want patients to understand that if you are dealing with pain in your face, above your eyes, below your eyes, you've got that pressure, maybe headaches, it's hard to breathe through your nose, maybe your nose is running all the time, you feel tired, you don't wake up with energy, you maybe you're tired at 3 p.m. and you just generally don't feel rested, or you're maybe embarrassed at work about how much you have to deal with your nose, or even missing work potentially.
We see
all those things, you don't have to live that way. And I would suggest that a good next step would be to book an appointment, see Dr. Leeman, and see if there's a solution for you.
Yeah. And I am 100% confident that we can definitely find a solution that will improve your quality of life. And it may be that balloon procedure I talked about. We also have other procedures where we use some cold therapy delivered on targeted nerves in the nose that really help reduce that nasal drip. And then we do a great job of evaluating you for allergies. If you ever thought, hey, I think I have allergies, and these particular airborne allergies at certain times of the year when your symptoms flare up, we can basically eliminate those as well. So we are really your one-stop shop for anything that's related to your nose, sinus, postnasal drip, congestion. And I even tell you now, we're doing things as far as helping people with pressure in their ears and opening up that tube that connects the back of the nose to the ear in a very safe fashion that really, before we were lots of over-the-counter medication, antibiotics, or even making an incision in the eardrum to help relieve that pressure and fullness in the ears. You don't have to do that anymore. We have a great tool where we can deploy right here in the simplicity of the clinic when within 5 minutes be pretty much done with that procedure.
Wow.
So it has really revolutionized my practice and how we treat these patients. And it's something I'm very passionate about. I want everyone that comes through my doors to have an improved quality of life, improved sleep, improved, because they're breathing better, they're sleeping better, they're able to function at a higher level. And it's just so powerful.
That's great. Well, Dr.
Yeah,
Leeman, I really appreciate you taking the time with us today.
absolutely.
And for any patients out there, please reach out with questions or book your appointment and find out if there's a solution for you.
Thank you so much. Appreciate your time, Sid. Thank you. Be safe.